Every 34 seconds, someone in the world dies of cardiovascular disease. For decades, people believed it was just bad luck or bad genes. But Dr. Caldwell Esselstyn's research shattered that myth, and it could affect you or someone you love if you don't act now.
Coronary artery disease is the leading killer of women and men in Western civilization.
Dr. Caldwell Esselstyn is one of the most respected heart surgeons in the world, renowned cardiologist at the Cleveland Clinic, pioneer of plant-based nutrition for heart disease reversal, demonstrated the power of nutrition to prevent and reverse heart disease before statin drugs were widely available. He has demonstrated that the number one killer of men and women today, heart disease, is caused by food. And the solution? It's also food. Yes, food can prevent those heart attacks. In this video, we're breaking down the top 7 vegetables Dr. Esselstyn recommends to protect your arteries and fight back against heart disease. Stick with us for just 10 minutes, because what you'll discover here could save your life or the life of someone you love. Understanding how food affects heart attack. Here's why these vegetables matter. Your arteries are lined with a thin layer called the endothelium, like Teflon, that keeps blood flowing smoothly. When it's healthy, it makes nitric oxide, a chemical that relaxes blood vessels and prevents blockages. But the Western diet, full of oil, meat, dairy, and junk food, damages the endothelium. Cholesterol sneaks in, builds plaque, and if that plaque bursts, a clot can block blood flow in minutes. That's a heart attack. Here's the good news. Certain plant foods don't just protect the endothelium. They actually help it heal. Which brings us to our list of 7 vegetables. Vegetable number 1, kale. Packed with nitrates, kale boosts your body's production of nitric oxide, restoring the endothelium's natural defense system. It's also loaded with antioxidants like vitamin C and beta-carotene, which mop up free radicals that damage blood vessels. Studies have shown that daily servings of kale can reduce LDL cholesterol while increasing HDL, the good cholesterol. Whether it's blended into a smoothie, chopped into a salad, or lightly steamed, kale is a direct strike against plaque buildup. Think of it as your heart's best leafy green shield. Vegetable number 2, broccoli. If kale is the king of greens, then broccoli is the king's loyal bodyguard. It's part of the Cruciferous family, but it packs unique compounds that deserve their own spotlight. One of the most important is sulforaphane, a powerful antioxidant that switches on the body's natural detox pathways. Dr. Esselstyn reminds us that cruciferous vegetables act like medicine. Sulforaphane in broccoli reduces oxidative stress, the very process that makes LDL cholesterol dangerous to artery walls. Beyond that, broccoli is one of the richest vegetable sources of vitamin K and vitamin C, working in tandem to strengthen blood vessel walls. Broccoli also shines in real-world evidence. Populations with higher cruciferous vegetable intake consistently show lower rates of cardiovascular disease and stroke. That means your roasted broccoli side dish or your broccoli soup isn't just tasty, it's extending your vascular lifespan. Add it raw to salads, blend it into a soup, or steam it lightly to preserve the maximum nutrients. Broccoli belongs in your weekly rotation if you want your arteries to stay clean and resilient. Now, if you care about heart health, your like helps this vital info reach more people. By liking this video, you're not just watching, you're joining a movement to help more people take control of their heart health and recover stronger. Vegetable number 3, bok choy. Now let's talk about bok choy, a cruciferous vegetable often overlooked in Western kitchens, but cherished in Asian cuisine. What makes bok choy powerful is its combination of nitrates, vitamin K, and unique antioxidants called glucosinolates. These compounds support healthy arteries by reducing inflammation and preventing oxidative damage. Dr. Esselstyn has often emphasized that the daily, repeated exposure to greens like bok choy bathes the endothelium in nitric oxide, restoring the body's natural shield against plaque. In fact, he observed that when his heart patients included cruciferous greens daily, they not only halted disease progression, but in some cases reversed it. This is not exotic medicine. It's bok choy in your stir-fry, bok choy in a broth, or bok choy steamed alongside brown rice. Simple, delicious, and deeply protective for your arteries. Vegetable number 4, spinach. Spinach may look humble on your plate, but inside your body, it's a nitric oxide powerhouse. Like kale, spinach delivers plant-based nitrates that relax blood vessels and improve circulation. But spinach has another secret weapon. It's one of the best natural sources of magnesium, a mineral that regulates blood pressure and keeps heart rhythm steady. Research has shown that higher magnesium intake is linked to significantly lower risk of heart disease and sudden cardiac death. Plus, spinach's lutein content helps prevent artery thickening. Toss it into soups, stir-fries, or sandwiches, and you're feeding your arteries exactly what they need to stay open, flexible, and healthy. Vegetable number 5, beets. Beets. Let's talk about a vegetable that doesn't just protect your arteries. It supercharges your circulation almost instantly. The beet. Beets are one of the richest sources of dietary nitrates on the planet. When you consume them, those nitrates are converted into nitric oxide, the molecule that relaxes and widens blood vessels. This effect is so powerful that athletes use beet juice before competition to boost stamina and oxygen delivery. Dr. Esselstyn often highlights that it's not just about reducing risk, it's about restoring your body's natural defense. Beets do exactly that. In clinical studies, regular beet consumption has been shown to lower blood pressure within hours, improve blood flow to the brain, and reduce markers of vascular stiffness. And unlike some greens, beets bring versatility. Roast them for a sweet side dish, grate them raw into a salad, or blend them into smoothies for a nitrate boost you'll actually feel. If your arteries could vote for a favorite vegetable, beets would be at the top of the ballot. Vegetable number 6, Swiss chard. Next up is Swiss chard, sometimes called rainbow chard because of its vibrant stems. Beyond its beauty, Swiss chard is loaded with magnesium, potassium, and calcium, minerals that work together to lower blood pressure and stabilize heartbeat. But that's only part of the story. As Dr. Esselstyn explains, these greens restore nitric oxide, keeping arteries flexible and resistant to clots. Swiss chard also contains betalains, natural pigments with strong anti-inflammatory properties. These compounds reduce the kind of chronic inflammation that fuels arterial plaque buildup. According to Dr. Esselstyn, patients who consistently consumed greens like chard experienced dramatic reductions in angina and other symptoms of blocked arteries. Imagine that. Less chest pain, less fear, and more freedom from something as simple as eating a vegetable sautéed with garlic or folded into a bean soup. Swiss chard isn't just colorful food, it's medicine on a plate. Vegetable number 7, Arugula, rocket. Now let's finish strong with a leafy green that often flies under the radar, but is a true nitric oxide powerhouse. Arugula, also known as rocket. When it comes to restoring blood vessel health, arugula may actually outperform kale and spinach. Why? Because it's one of the most concentrated natural sources of dietary nitrates, the raw material your body uses to create nitric oxide, that miracle molecule that relaxes arteries, keeps them smooth, and prevents clots from forming. In fact, studies show that eating arugula can boost nitric oxide levels in the blood within hours, improving circulation almost instantly. That's why athletes around the world are now turning to nitrate-rich greens like arugula and beet juice for endurance and stamina. But for everyday people, it's not about running faster. It's about keeping your arteries open and flexible for life. Arugula doesn't just stop there. It's packed with vitamin K, which strengthens bones and supports blood vessel structure. It also contains unique plant antioxidants called glucosinolates, compounds that protect cells from oxidative stress and reduce inflammation inside the arteries. The best part? Arugula is incredibly easy to eat. Toss it fresh into salads, layer it into sandwiches, blend it into a green smoothie, or even sprinkle it on top of a warm dish as a peppery garnish. Unlike some heavier greens, arugula is tender, light, and versatile, making it a simple way to bathe your endothelium in nitric oxide every single day, just as Dr. Esselstyn recommends. So when you think of arugula, don't just think of salad garnish. Think of it as a stealthy artery protector, quietly guarding your heart with every bite. Let's quickly recap the 7 vegetables Dr. Esselstyn recommends to protect your arteries and fight back against heart disease. First, kale, packed with antioxidants and nitrates. It lowers bad cholesterol and strengthens your natural defenses. Second, broccoli, rich in sulforaphane. It fights oxidative stress and helps keep artery walls strong. Third, bok choy, a cruciferous green with vitamin K and glucosinolates that calm inflammation and heal your endothelium. Fourth, spinach, a nitrate powerhouse loaded with magnesium to relax blood vessels and regulate heartbeat. Fifth, beets, famous for boosting nitric oxide and instantly improving circulation. Sixth, Swiss chard, full of minerals that lower blood pressure and anti-inflammatory pigments that protect against plaque buildup. And finally, arugula, one of the most nitrate-rich greens you can eat, giving your arteries daily protection. These aren't just side dishes, they're medicine on your plate. They heal your endothelium, restore nitric oxide, and reduce the risks of heart attacks and strokes. But here's the key. None of this works if you only know it. It only works if you do it. Every meal is either fueling disease or fighting it. You have the power to choose healing. If this video opened your eyes, don't just scroll away. Like this video so YouTube shows it to more people. Subscribe so you don't miss the next life-saving insight.